Hi, my name is Dawn Lewis, and in this short video we are going to talk about turning the pelvic floor muscles back on to promote urination. Now I'm doing this specifically for men and women, but mostly men, who cannot urinate after having surgery. We don't know what causes this. There's speculation that it might be the anesthetic. Some people think it might be the catheter that they use during surgery. I do believe, however, that this technique that I'm about to show you, that anybody can do this. So it doesn't have to be a massage therapist. Anybody can do this, but you have to have somebody do it to you. So it's not something you can do to yourself. You must have somebody else do it to you, but it doesn't have to be a therapist who does it to you. It's very simplistic and it's a very short routine. At this point, I have worked on not quite a dozen people, and each one I've had success with. But I don't think that's enough people to really say that this will work every time. It is, however, worth a shot, because if you're having this problem, you don't want to be on a catheter you don't want to be on a catheter. The longer you're on the catheter, the more damage you cause to your body, and then this becomes kind of a perpetuating cycle. The more damage you cause, the more inflammation, the less likely you are to actually urinate. So they have to use the catheter, otherwise it's dangerous, but the catheter itself can actually enhance the problem. The timing of this is really important as well. So you want to have somebody do this, or you want to do this to your partner right before they go to have the catheter removed. So, and you may have to repeat this 2 or 3 times of them having the catheter removed. Just make sure that your timing is right before, like the day they're having the catheter removed, do it that morning, or do it right before they go in to have the catheter removed in the afternoon. All right, so let's get started. So the first thing we're going to do, and this is my son-in-law Nick, who I have wearing clothes because I want to show you what this looks like with clothes on, okay? You're going to take your hand closest to the feet, and you're going to walk your hand down the belly. What you're looking for is the top of the pubic bone, okay? Now in men, the top of the pubic bone is a little bit higher. It's right here, okay? In women, it's about 2 inches lower. So you're actually going to come all the way down to about here. When you hit the top of the pubic bone, you want to just rest the edge of your hand there. You're going to use your other hand, the hand closest to the head. You're going to move that underneath the body. Now you're not going to be able to see me do this, but directly across from where my hand is here is the sacrum, so the bone between the hip bones. Put your hand right underneath the sacrum and just let the sacrum rest in your hand. So I'm going to go underneath, placing the sacrum in my hand, and then what I'm going to do is I'm going to draw both of these bones down toward the feet. So just move both of your hands straight down. And now a little bit toward one another, so a little bit toward the middle of the body. We're going to hold this for about 20 to 45 seconds. You can even hold it up to a minute, and it's really just this easy. The truth is that anybody having this problem, their body is already traumatized. They're in protective mode. So you really don't want to do too much. And this entire sequence might take you 10 minutes. You can repeat it. You can do it twice. But you don't really want to do anything with it. You know, like you wouldn't want to have a full massage. That would give the body too much information to deal with. You really wanted to pay attention to what you're doing. So let's do this one more time. You're going to come from just above the belly button, walk the hand closest to the feet down until you come to the top of the pubic bone, okay? Top of the pubic bone. You're going to take the hand closest to the head, dive under the body so that the sacrum, the bone between the hip bones, is right on top of your hand. Then move both of those toward the feet. This is a small movement. You're not going to move a lot here. And then just bring your hands together just slightly. Again, a very, very small movement. And just hold that. Again, you want about 20 to 45 seconds out of that. In this move, what you're doing is you're helping to turn on the pelvic floor muscles. What I feel most of the time when I work on people who are having this problem is that the pelvic floor muscles have turned themselves off. Now that can be because of the anesthetic. It could be because of the catheter or just the general trauma. Okay, so I'm going to let this one go. Next, we're going to release the pubovesical ligaments, the ligaments that come from the bladder to the pubic bone. So again, we want to find that pubic bone. This time I'm going to go a little bit on top of the pubic bone. Okay, we're going to use the pubic bone, we're going to bring it straight up. Again, you see this movement is very small. We're going to bring it straight up toward the navel, and I'm just using my pinky to do that. And you hold that for about 20 to 45 seconds as well. This is going to release the ligaments actually going to the bladder so that the bladder can be more buoyant, which is again going to help with this urination problem. So let's do that one more time. We walk down, finding the pubic bone. We want to be right on top of the pubic bone, and we're going to use that and move it straight up toward the navel. And the movement is very small. In making these small movements, we don't create excess trauma in the body. If your body is already in protection mode, you want to move as little as possible. Give the body just a small amount of information and it's going to really take it in because it's already protecting itself. Our next move I'm going to stand up for. We're going to release other ligaments coming into the hip joints and other muscles, specifically coccygeus, which is coming diagonal toward those hip joints. So you want to put your hands on the hips, right at the top of the thigh bones, the femurs, and you're going to move those diagonal toward the navel. So you're coming up and in with both hands toward the navel like you're making a point, and just hold that. This is a little bit larger of a movement than we have been making. But again, not huge considering the size of the bones. We're going to hold that again for just 20 to 45 seconds. Let's get our placement again. We're right on the sides of the hips. And we're just going to bring that in and up in a diagonal line toward the navel. Now, you'll never make the navel. The hips aren't going to move that much. But that's your intention. That's your line of movement. After about 20 seconds, 30 seconds, we can release that. Now you can come back, feel this tissue again. You're just trying to see if the tissue has changed at all. Probably won't mean much to most of you. The last thing that we're going to do is we're going to turn him over. Now, this is an interesting move because sometimes, for some people, you won't be able to turn them over onto their stomachs. They've just had surgery and they will not be able to lay on their stomachs. So you may not be able to do this move at all. You may just need to repeat what you've already done. All right, so we're going to go ahead and turn him over. So go ahead and flip over. Now you'll notice that I did not put a face cradle on this table, and that's deliberate because most of you, of course, do not have massage tables. So you're going to be doing this on a bed or on the floor. And once again, I would say to you that if whoever you're working on, if their surgery stops them from being able to lay on their stomach, just don't do this move. Okay? What we're looking for here is to see if the sacrococcygeal joint is aligned and if the coccyx, the tailbone, is aligned. So you're going to walk down the sacrum, this bone that we were on when he was laying in the other position. As you walk down with your fingers, you're going to hit kind of a ridge. This is the sacrococcygeal joint. Okay? So take your thumb of the hand closest to the head, put it directly over that ridge so that you're right over the joint. You're going to bring this joint straight up and hold it. You're just going to hold this for 20 to 45 seconds. Okay? This isn't a big move. You don't have to try and really move it toward the head or move it toward the back. You don't want it to move that far. So it's a very small movement. Just bring it straight up and just hold it there. Let's do that one more time. Again, we're going to walk down the middle of the sacrum. You'll feel these ridges here. Okay, these are the spinous processes of those vertebrae. Walk straight down the middle until you feel like a big bump. It's kind of like a speed bump. Okay, take the thumb of the hand closest to the head, put it over the top of that ridge, and just draw straight up toward the lower back. This is the last move that we're going to do in this series. And again, I would say to you that if you are a therapist, you're going to be tempted to go further than this and to do more. That is actually a mistake. What you want is to do just enough to spark the body, to turn those pelvic floor muscles back on, to enhance or create the sensation of needing to urinate so that that catheter can be taken out. If you're not a therapist, this may seem like a lot to you. It's actually fairly small, and every movement you make is fairly small. All right, so we're going to release that. We thank Nick for being our demo today, and that is it for this video.